Hi, everybody.
Hi, everyone. Welcome. Thanks for tuning in to our chat on cooperative care and grooming and vet skills and all the stuff we need to do to prepare or fix our dog
Right,
for
exactly.
these situations.
Yeah. Yeah. Should we do quick introductions?
Oh, snap. Sure. Go for it.
Okay. I'm Heather Ringwood, one of the folks here on your webinar and at Happy Dog Institute. You'll find me at a lot of our core classes and some of our sports classes and our agility program.
I'm Emma Hawley, and I am here as well. I'm behind the scenes a lot at Happy Dog Institute, the administration person, first contact a lot of times, and then also I do a lot of behavior consulting, so aggression, anxiety, and prevention, ideally, right? Which is the topic for today.
Awesome. Yeah. And I am Paul Grossart. I teach a lot of the puppy classes, puppy 1 and 2, and the chaotic canine class. And I pop into other things periodically.
Perfect.
All right. Cool. Okay. So what is cooperative care to begin with? Does anybody want to, how do y'all go find it?
Yeah, I've had to switch my verbiage over because I've always called it husbandry and get a whole lot of blank looks when I say that in class. So we have one section of our Puppy 3 and Fun Foundation core classes where we talk about this skill. And so I've finally been getting with it and changing the wording to cooperative care. And for me, this sort of, at least I define it as anything that we would need to do to our dogs that involves their care. So we brainstorm that a lot, and I'm sure we're going to talk about kind of the specifics of that. But just being aware of those things that our dogs have to do. It's kind of like our own personal care as well. So thinking about, for us as humans, like, brushing our teeth, making sure we're, all the general grooming things, all the taking care of going to the doctor, and those things apply to our dogs as well.
Totally. Yeah, I think what I love, like, and especially as like positive reinforcement-based trainers, we're all about prevention, right? And
Right.
there are a lot of uh health issues, normal things that can kind of come up that will create prolonged like discomfort or behavioral issues in our dogs, right? And so getting in the habit of like normalizing some of the just care, checking out your dog and making sure, I think historically, and I'm sure I've been there and I'm sure others have, but like when we force our dog into a situation they don't like, we're not like, oh yeah, let's do this again in another week, right? No, I don't want to cut your nails ever. I will deal with them when it's a big issue again. And so if we can normalize it with our dogs and make it like fun and reinforcing, then that means that we can be a lot more on top of any issues that could come up, right?
Right.
Yeah.
Cool. So general, I thought I'd list like general topics that we'll discuss, kind of defining this, what are main areas of grooming and maintenance for vets and for at home, like for vet visits, some quick tips for preparing for vet visits or even like maintenance, right? Grooming in between as you're working on this, how to set up a training session, what you would even start to train if you were going to do this. And I also wanted to talk about like management ways that we can either things we might implement to make the situation easier on our dogs, but also some like quick tips for maintenance in between actually getting stuff done, right? Like nail trims.
Sweet. Perfect. That's great.
Neat. All right, so diving right into this, how what are some areas that how do you know when a dog's uncomfortable, right? Like, let's say that you have a dog. I mean, I've had, minus my puppy, I've had all my dogs for at least 4 years now, right? So like,
Mhm.
how would I know if they're even uncomfortable, right, with me doing this when we've been doing it periodically for years?
Yeah. For me, it's, we we all get to know our own dogs, and I think that's important. And so for me, it depends on which dog it is and what it is that I'm sort of asking them to do. I watch for like frozen body language, um, big eyes, you know, um, freezing. I said that already, but that's still tense, like you said, body language, um, or a flight response. My dog's like, there. I have one dog who the toenail clippers come out and my dog leaves. Right.
Yeah.
So it's like that flight response. And so I watch for all of those things too. I'm also very have become more aware of not being on a timeline myself to take care of these things, right? So incorporating them in, so I'm proactive about things that maybe that, like you mentioned, working it into everyday kind of training, getting them comfortable with restraint, all of those types of things. But also when like it's down to it and I need to trim somebody's toenails, that I don't do it the hour before I have to have it done, that I'm planning that in so that I have time to accommodate my dog's discomfort.
So if they
That
run away, you can
Right.
be like, or if they're exhibiting flight signs, then you can like, address that and make it short and sweet, right? And then
Right, exactly.
I'm sure we'll talk about that.
Yeah.
Yeah, and I think a lot of that, like even that pressure of being on a timeline, right? Like how many times are we like, we're gonna go to the dog park, but dog park. We're gonna go on an
Right.
adventure with our dog, but we're already running late, and then the pressure starts adding up, and then suddenly like either our dog's super escalated and they're like, we're going out, this is amazing, right? Or they're like, I'm not following you wherever you're going. I don't like any
Right.
of this, right?
Exactly.
And
Yeah.
so I think like that plays into, even leaving for vet visits. I think that plays into the stress of nail trims or
Mhm.
brushing, right? If you find that your dog has a mat, right? And you're like, no, I can't stop thinking about this until this is off of your body,
Right.
right? And your dog's like, well, it's staying forever. I have named
Right.
it now.
Exactly. Leave me
Um,
alone.
Yeah.
So yeah,
Yeah.
that's a lot of similar things that I look for. Something that I introduced in the puppy class is the hand licking. I know a lot of times people think that when your dog, like you're touching your dog and they move their nose and start licking your hand, that you're like, oh, you're really enjoying this, right? But more times than not, it's an appeasement gesture of like, hey, this is getting a lot, right? And that's normally the precursor to some like muzzle punches and then some nibbling, right?
Yeah.
Which is like,
Mhm.
Yeah.
and so definitely like getting in tune to your dog and what those warning signs are. I also like to, I know we probably talk about it in every class, honestly, the difference in the ways that our dogs eat. Right.
Mhm.
So if they're taking treats really heavy and hard, or if you have like, we'll talk about it later, but like a licky mat out, right? And they
Mhm.
go from like soft, cool licking to like suddenly biting at it. That can be a sign that things are escalating a little bit, just not directed at you, right?
Yeah. Right.
Yeah.
Yep.
One thing that I
Totally.
wanted to mention about the licking piece, the folks at Family Paws call that kiss to dismiss. Specifically
Yeah,
when relating to like approach with children, but similar idea, right? It's like,
Mhm.
go away, go away, go away. Right?
absolutely, right?
Not
Like,
fucking cute, but
yeah. I try to do like explain it like I'm not mad at you or anything, but I just don't need you to be here right now,
yeah,
right?
go
Mhm.
away, go away.
So alternately, how do you, because these are, the goal is to get our dogs more comfortable in these situations, but they're probably not starting comfortable. So if we know
Mhm.
what our dogs look like when they're uncomfortable, how do we know that we're in our training sessions, we're putting them like they're comfortable, right?
Mhm.
I mean, for me, comfort at home looks like you're curling up to take a nap, right? Like slow, calm body movements. But then there's that whole like fuzzy in between where like we know this is
Mhm.
stressful,
Yeah.
but you seem like maybe you're not like enjoying it, but you're seeming like you want to participate. You're a willing participant.
Mhm. Yeah, I like that distinction, right? Because I know that, I mean, not unlike myself, I'd just as soon rather not go to the doctor, but it's like that, that they making sure that they're comfortable in the situations and knowing that yeah, it wouldn't be their first choice. They're not like ready to curl up and have a nap if I'm doing nail trims or if I'm, in a vet clinic office. But being, having that loose body language, tail wags, being happy to see the people, wanting to interact with the other people who are there. Um,
Yeah.
takes food in a normal manner, right? I have a shark who when, he'll still eat when he's um uncomfortable, but he takes food very hard, right?
Mhm.
So making sure that those are things that that I'm supporting my dog with as well.
Yeah.
And I think, yeah, and where they're able to be during all of those things, is also like this picture that we have in this slide is very telling. It's like there's some things about that for some people are like, oh, that dog's just getting groomed,
Mhm.
right? And for us with our trained eye, the dog isn't in a position to be able to leave. They're on an elevated table,
Yeah.
right?
His
They can't
eyes.
get down.
Yeah.
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 I was just gonna say that we've been practicing this a lot at home with our senior dog and getting like massages, right? And
Yes.
the vet recommended when I took him to the vet, he this particular vet, he's had really positive experiences with her. So they have a bed on the floor. He just flopped down. I was like, yes, please, I'm ready. And I haven't been able to replicate that at home. So it's kind of ironic, right? Backwards. But talking about practicing with the 7-year-old, giving him massages, and the dog is a little wary of the 7-year-old sometimes, right? Because he's 7.
Yeah.
And so we've been talking a lot about like, what is he was massaging him the other day. He's like, is he liking this? And I was like, well, I don't know. Is he getting up to leave? Let's give him a break. Let's see what he does. Right. And he didn't, he was happy. He looked really relaxed. He didn't even stand up. He just sat and, you know, and participated. So even just information like that, right? Choosing to stay,
Mhm.
giving
Yeah.
the choice, observing like what happens when we give a dog this option and then they're like, nope, I'm good. Right. That's really informational.
Yeah.
Yeah. And I think when we talk about, and I mean it'll right, like giving our dogs that choice, right, is a huge part of this. But you also like taking learning history into account, right? Where like
Mhm.
Emma, I'm sure your dog is used to like having that choice, right? Like, oh, we're just gonna walk away. You can follow us, you can go to a different couch, whatever. And understanding that like some dogs and even like puppies, right? Like they don't have the learning history of having a choice. So you might step back and be all like, are you going to stay? Do you like this? Right. And your dog might be frozen. Right.
Mhm.
They might not know how, like it sounds weird, but they might not know how to leave
Yeah.
the situation or
Totally.
run away.
Yeah.
And so I love to like, and we'll talk about it later when we talk about breaking down like a training, right, plan. But like just getting used to like tossing a treat or excusing your dog, right? Or walking away, right? Like
Yeah.
not only are we going to step back, but we're going to turn our backs, right? And we're just
Right.
gonna, I think that's
Or even just give them that break. Like notice that like
yeah.
if we can set up our training time to be less than, like less than they pushing them to an end where we have to ask it. Like if
Totally.
you're like, okay, let's do, let me look in your ear. Oh, that was awesome. All right, well, I'm done. Right.
Yeah.
It's like, and it's just that we keep it real slow and mellow and short.
Totally. Yeah. All right.
Yeah.
So real quickly, because we didn't really think about, well, whatever. It didn't come up, right? But like, how do we know now that we're talking about comfortable and uncomfortable, right? Like,
Right.
who should continue watching this, right?
Right.
Because I don't want to, like, I know as trainers are probably going to say, just assume your dog's uncomfortable and let's just continue.
Right.
Right. And so how do you know, right? Either working with clients or in yourself, right? How do you know that this is a route you should go down?
The route of staying with it.
Yeah, like cooperative
Uh-huh.
care, breaking down the training sessions, right?
Right. Got it. And I think maybe we do this later, but let's define what we would consider cooperative care, right? What are some of those tasks? What are some of those things?
Yeah,
Should we
totally.
do that now, or are we doing that
No,
later?
let's wait. Yeah.
Okay, sounds good.
Of course, the behaviorist in me thinks, well, we should always be breaking down these tasks, right? We should always be like setting up positive experiences as much as we can. We should, because experiences compound and they build, and our dogs remember everything. I mean, not everything.
Yeah.
But they do. They remember. So why not assume that there's going to be an issue if we don't prevent one, right? Why not give our dogs choices from the get-go and give them those chances and clip one nail at a time in anticipation that if we don't, it might get stressful for them, or not put them up on the table at the groomer, the vet, give them some autonomy. But so that's my opinion. But.
Yeah. No, I think that's a great way to frame it, right? Like going back to some of that prevention, but like also the like, well, why not, right? If you can make it better, if you can make it easier or more fun. For like for me, like I am just as much a part of this. My feelings around grooming are just as much of a part of doing cooperative care with my dog as my dog's feelings are, right? I don't like feeling stressed. I don't like feeling pressure. I don't like feeling like, my dog just got like, I don't do a lot of teeth cleanings, but my Chihuahua just got like 7 teeth pulled, right? And like, wow, if I had like brushed your teeth or like just checked you more, right? Like maybe I could have prevented that a little bit. Also, Chihuahuas have terrible teeth, so who knows?
Right.
Right. But you know what I mean? Like instead of having like a big scary thing later, right? If I know what I'm looking at and I'm looking at it consistently, then yeah, we can just make it easier, more
one of the things, for me, the reason why this became kind of more relevant forefront of my mind is that now my dog's barking, is that I framed it in a way in my mind is that I don't want the first time my dog ever wears a cone to be when they wake up from surgery and they're in pain, right? I don't want the first experience of my new puppy in my house to be that I have to give them force pills down their mouth, right? It's like, so I don't, because of that association that we talk about, and that setting them up for success kind of idea, but it's like that's where the guilt for me comes in, like as an individual, kind of, you talked about like, your feelings too, is like, I just don't want my dog to feel that way the first time when they're also potentially in pain, right? So I'd like to be able to set them up for as many things as I possibly can think of, or help, or once it becomes relevant, right? Because now all of a sudden, let's say my dog got injured for some reason and they need to have regular workouts in a I don't know, underwater treadmill or something.
Yeah,
My
like
dogs never
PT.
like to go swimming. It's like, I
Yeah.
don't want to. It's like, if I'm going to set them up for a place where they can, I can help them, I also want them to be comfortable with that, and so I don't have the guilt of like, oh God, I know you're going to have to go through this. I'm really sorry.
Yeah.
Um,
I love that.
Yeah.
I really love that. Yeah. And I
Yeah.
think that really helps people. All right. Let's see what's next. I don't know at this point. Yeah, let's dive into some of this.
all right.
Anybody want to chat about? So, I know, and I'm sure we've all experienced it, right? I think there are, under cooperative care, right? A lot of like household husbandry, grooming, care falls under that category, as well as vet stuff, right? Like there's this nice, instead of thinking them as separate things, well, at home we trim nails, at the vet we get vaccines, right?
Mhm.
We're starting to blend these together, right? These are all
Mhm.
things that we can work at because they're all relevant. And so as we're doing that, right, we can also kind of generalize this to more general behavior stuff. And sure, I'm certain that everybody's had the experience where they're headed to the vet, right, and their dog's all like, we're going somewhere fun, and then you get to
Yeah.
the vet, and they're all like, I'm not leaving the car,
Yeah.
right? And then from that moment on, we're pushing and we're pushing and we're pushing, right?
Mhm.
And so as trainers, we know this is trigger stacking, right?
Mhm.
Favorite.
Same thing like at home, right? Where we get our dog in the area we normally do nail trims, and then they see the nail trimmers and they're like, no. And
Right.
so
I'm
we
out.
coerce them, right?
Mhm.
All right, what do we need to do? We're just gonna get this done. And then we do 3 nails, right? And then they're all like, okay, fine. Then you do 4, and you're all like, yeah, we're gonna do all 20 or however many nails your dog has,
Mhm.
right? Like we're gonna do all of them.
Right.
And we know, right, as trainers, that like the chances of that getting done in a pleasant way is very slim, right?
Yeah.
Every nail is trigger stacking onto that.
Mhm.
So I don't know, Emma, you got very excited. Would you like to talk a little bit
I'm
about
such a nerd. Yeah. I'm just thinking of all the scenarios, right? Like, I guess the things that it's hard with trigger stacking is hard, right? Because a lot of times we don't realize that we've been trigger stacking until our dog loses it, right?
Yeah.
So
Totally.
it's like hindsight, it's 2020, right? It's like
Mhm.
when a dog does a shake off, right? Like literally a wet dog shake when they're not wet, right? Like as a like stress reliever, that tells me more information about how the dog was feeling, right?
Mhm.
Yeah.
And well, too late now, right? It's good information. It's information, right? So thinking about, when we get to that point, so that's where the prevention comes in. It's like, well, we can assume that doing 20 nails in one sitting when our dog isn't comfortable with even 1 or 2 is trigger stacking, right? We can prevent that. So if we can break
Mhm.
things down, but then also using and prevent, like, okay, the waiting room is probably trigger stacking at the vet office, what like I could talk about that lots of different things forever, but using it, what we learn is information, right? and reevaluating, going, okay, well, what can I do differently? How can I identify triggers? But I kind of got off track there, but yeah, that's
No.
so yeah.
Mhm. I think the other thing is to think about it. So here again is my guilt, right?
Right.
So it's like, how many times have I, and I'll just talk about me personally, but I imagine it applies to other people too. But it's like, you're like, oh crud, my dog's going to the vet this week. They haven't had a bath for a month, right? Their nails are out of control,
Yes.
right? And so then we even start before that. So now I'm stressing about the fact I haven't taken my 17-year-old dog in the car because he generally doesn't like it until I go to the vet, right?
Bingo.
So now there are things of like, okay, now I made my dog not stinky so that I don't have shame at the vet clinic. Now, and I've done their nails again, so I don't have personal shame at the vet clinic. And I put them in the car and think when I put them in the car, oh my God, the last time you were in the car was when you went to the vet too,
Yep.
right? and it's just like, wow. So not only is it trigger stacking for the dog, it's trigger stacking for me.
Yeah. Yeah.
But I've then put the dog through all of those things, right? So it's like, and so being really aware of planning for that stuff and making it so that it's not a like, okay, morning of vet clinic, you get a bath, you get a nail trim, you get in the car, you go to the vet. Like,
Yeah.
there's a lovely recipe for overwhelm
No kidding.
and,
Yeah.
or worse
Absolutely. Yeah,
reaction. So
absolutely. And I think like maybe a little bit later we can kind of talk about like, I think advocating for your dogs and also knowing when to stop before, right? So
yeah.
one of the things that we do in our chaotic canine class, right, is we have everybody write a reactivity scale, right? So what does it look like when your dog's calm? What does it look like when they're like, they'll still take some treats, they'll maybe do a cue or two, and then what does it look like when they're at like 100, or like what is your worst case scenario, right? And I think having an outline for ourselves of what does my dog look like, and so I know when to stop before that, right?
Yeah,
So in
love
this
it.
yellow zone, right? When is my dog maybe slightly uncomfortable, still kind of choosing to engage in this, right? And making sure that we're stopping before then, right? And getting in the habit of stopping ourselves, because I know sometimes we get overeager too, right? Of course, we can do a bath and a car ride and a vet session in the same. Yeah, like
sure.
you'll just have a long day and then you'll rest
Yeah,
after, right?
exactly. You'll recover.
Yeah, and so making sure
You're
that
fine.
instead we're predicting those things, right? You hated the bath
Mhm.
last time, so do you need a bath? Can we just I do like a diluted shampoo spray, right?
Mhm.
Especially as we get into whenever the rain starts coming and we get into muddy season. So I'm not bathing my dogs every week, right? But can we do like a wet towel, right? Or a dry towel bath, right? Something that at least gets you a little less stinky, a little less greasy,
Right.
without having to go through all of that, especially knowing that there's more to come, right?
Mhm.
I mean, how many of us try to plan baths and nail trims or brushes or whatever at the same time?
Right.
Yeah.
Right. Yeah, let's get it checked off the list as
Yeah,
human
right.
beings. And
I got an
yeah.
afternoon free. Let's just
Right.
Yeah.
Yeah.
so yeah, like really kind of honing into what, and this is what's going to be personal for everybody's dogs, but like what is that yellow zone? What is the like,
Mhm.
oh, we're getting into the lot, right? And making sure that we have a plan to stop while we're ahead.
Right.
I love
Yeah.
that. Yeah.
Oh, all right, what's next? Management. This is great. This is great for vet stuff. And so one of the things that kind of came up is, right, with like the trigger stacking is, and I think through all of this, there are some situations where one, we just have to get some stuff done.
Mhm.
Two, right, what do we need to help our dogs feel safe in these settings, right? And I mean, Heather, you brought up surgeries and emergencies, right? There are some times, especially as we're training these things or as we're thinking about it, right, that like stuff comes up, right?
Right. Yep.
And so I think of like management as this balance of like, how do we make sure everybody feels safe, right? Or as safe as possible. And then also another management tool is like talking about medication, right, to help with some of that. I don't know if either of you have.
Yeah.
Yeah. I mean, I think there's a lot of feelings about both of these, about management in general, right? That we're just avoiding the issue, right? Like we're not training the dog. We're just putting a Band-Aid on it. When I mean, first of all, it's about safety, and second of all, it's about, future success, right? So if we can use medication, for example, even though we might have a lot of feelings about it and wish our dog didn't need it and wish, but knowing that, oh, if this is going to make our animals feel better, right? The lights keep going out on me. If it's going to make our animals feel better, and it's going to make their experience better, and it's going to make the veterinary clinic's job easier, and the dog's not going to be traumatized, and it's not going to be that much harder to take them in the next time or whatever, then yes, please, right? I mean, it's really about helping the dog feel safer, and then Muzzles too, helping the clinic feel safer, and practicing that and trying to let go of any shame we have about Muzzles or any stigma, which is easier said than done, so that the clinic feels better, and so that's not a trigger stacking event for the dog too. But so yeah, lots of feelings I think about management, but it's really could be a game changer and really can help long-term success.
All right. I also think that I guess, I mean, this sort of falls into management, and it also falls into sort of advocacy for your pet. But, making sure that you are paired with a vet and their staff who you know and trust. So finding out who they are, right? Getting an idea of what the setting that you're taking your dog to looks like beforehand. So you can kind of go, okay, my plan is to, if my dog doesn't like cats and it's an open, now that we're opening the waiting rooms more, it's like, if I know my dog doesn't like cats, and this is a mixed clinic and there could be 15 cats in the waiting room, what do we do, right? So having some strategies for making sure that we're not having too much overwhelm happen in the waiting room. Maybe there's a way for us to go, leave your dog in the car until they're ready to go in, not sitting in the waiting room. Those types of things I'm also thinking about in terms of management. I'm managing that visit, right?
Yeah.
And I know that the veterinarians want to have, they want to stay safe too. And they want to keep their staff safe. So I love the idea of, making sure, especially if the dog is potentially in pain, having the option for Muzzles, where somebody is not apt to get hurt, right?
Yeah.
And that we also have a good gauge of how the dog is feeling about the interaction, and keeping everybody safe.
Yeah. So kind of thinking about like management as maybe like minimizing the potential for trigger stacking.
Right, exactly.
Right. And I think it's really like there's a lot of that's really important, right? And I think that especially these two, right, like meds and Muzzles were the first thing on my mind, right?
Yeah.
But really addressing some of the stigma around that, right? And understanding that like a dog biting escalates a situation, right? We have now hit like whatever comes after red in a trigger stacking scale.
Right.
I don't know what zone we're getting into, right?
Rainbow zone.
Yeah, right. Like all the colors at the same time. But like dog bites escalate the situation for everybody, right? Most dogs don't want to bite people, right? They don't want to be in the situation to bite. They don't want to bite, right? And so if we can implement, and Muzzles still require their own level of training, right?
Sure.
But if we can prioritize and implement those things, then we can at least try to minimize, right, some of that trigger stacking that could potentially happen.
Right.
I think advocacy is great. Like categorizing that under management is like, I think that's really great and powerful, right? What can you do to communicate to your vet your needs? Just because the waiting rooms are open doesn't mean you have to wait in the waiting room, right? There's plenty of times where I've been like, yeah, I like, if you need me in the building, I will sit right here, but my dog's in the car, right? My dog is not coming into this building. I've also never like all the vet clinics I've been to have tiny waiting rooms, right? Like it's trigger stacking for me. I don't want to be in there. But right, and I think when we're thinking about meds, I was just taking a webinar on like this, right? By some other trainers, and really destigmatizing that like it's okay if your dog needs medication, right, to undergo some of these, if that's gonna minimize or relieve the stress, right, of the situation, if that's going to prevent trauma and ongoing like prolonged issues, right? Because we know a lot of times our dogs will start to read into and connect these patterns, right? So if a bad situation at the vet suddenly creates fear around the car, that's a normal connection for dogs to make, right? If we can throw some meds in there to interrupt or minimize that pattern, right? My thing about meds is always try them at home. Ask your vet to try them at home before you try just throwing them in at the vet's office. But right, like if that's what it takes for your dog to not be traumatized and for you to not be traumatized, right? Sometimes that's okay.
Right.
That's not the worst thing.
Yes.
Yep. And we should clarify that, you know, we'd be working with your veterinarian to get these medications, to know what to try out and what to do in advance of going to the clinic. You know, it's always, whenever we talk about medication, it's under the guidance of our veterinarian.
Absolutely. Yeah.
And also, dogs are not the only species that require medication in order to relax in stressful situations or in life. Just to put that out there.
Absolutely. Right. Like neurology works the same.
Yes.
Absolutely.
All right. Okay. So outlining what even these basic skills are. I know that we've talked a bit about, in general, going to the vet. I think nail trims are just great and will always come up, right?
The first thing that we always
the first thing we think about. And so just kind of outlining what other basic skills are. And I don't, like, my intent is not to overwhelm anybody, right? But I think the difference between when I got my first dog and what I know now of things that I should be looking at, right? Like nails was like the only thing on my list, right? And then there's more things, right? Even for different coats, different coat types. And so feel free to chime in. I'll just like brainstorming, right? Basic for vets is vets definitely check face, right? So teeth, ears, eyes. I'm noticing less vets are doing temperature checks unless there's an issue, right? Unless you're there for a particular reason. Getting on the scale, always a stressful moment. I feel like whenever, like, first thing, my dog gets in and then we got to shove them on a scale. And there can be a lot of pressure from vet techs too, right? We just got to get him on, just get him on, right? And I'm like, oh, well, we're just going to take a deep breath now, right? He will get on when he's ready. Stethoscopes, right? So listening for heartbeats, any vaccine needs, right? That your dog's, and those can be administered in various ways, even just being handed to a vet tech or handed over to the vet, even if you're in the room, right? Like, my dog needs to stop looking at me and needs to look at the vet tech, right? And then also thinking about blood draws, which was definitely non-existent until my dog needed, like until I had to be in the room with my dog, right? My Chihuahua is very particular. We work on this a lot, but she will only do the skills if I am participating. And so she needed a blood draw, and I was like, I gotta, like, she's broken needles, right? Like, I'm like, she has broken needles before. I need to be there. And they're like, no, we got it. And I was like, great, I'll see you in 2 minutes. Couldn't even get a muzzle on her. So I go in the room, put the muzzle on, easy as pie. They're like, hold her like this and walk me through, which I was so appreciative that I get to participate in that, right? But also she would only do that for me. And so I think those are kind of like some of the basic like preparation stuff. I know that you talked about, Heather, cones, right? Wearing cones, wearing muzzles, that type of stuff. And then just kind of thinking about like basic care for at home, right? So teeth brushing, and even if you don't brush teeth, even just looking at them,
Yeah.
right?
Yeah, looking in their mouth, right?
Looking in their mouths, yeah. Because bones and chew, like, right, like I think that there are many ways to help with the teeth brushing situation, but even looking at their mouths, right? Looking at their gums, because that's a really important way to tell if they're sick or they're lethargic, right? Gum color. So nails, ears, right? A lot of things start with like ear infections. A lot of behavior issues start with ear infections. Also just like looking at their eyes, and not just like longingly, but like right. Is there anything in there?
Thanks for clarifying.
Yeah. So brushing, baths, and then medication. Those are kind of my like big. Are there other things, y'all?
Yeah. That's a really good list. And I think there's also spin-offs from all of that, right? There's there's things we can do to help our dogs prepare for all of those things. And most of us don't have a stethoscope laying around. But or scrubs even. But we do have things like like sheet pans that we cook on that are shiny and metal that our dogs could practice getting on. That's just like the scale or similar texture and feel and surface of the scale at the clinic. And then and yeah, I think it's a pretty comprehensive list, but there's always more, right? You always think about the things that have to be done in conjunction with being handed to a vet.
Yeah.
Right. Being removed from you. Right. So, I mean, your example, it's like if the dog being taken someplace else, I'm sure that that's to help, with them be more efficient and timely, and then they don't have to show you the restraint level or the distress that your dog might be experiencing, right, to get what they need to do done. So the more excuse me, the more we can be involved in that or help prepare our dogs for things like that, then the more comfortable they are going to be, our dogs, in that situation too. Anal glands is another one that comes up for a lot of people, like checking those things, right? Doing your own kind of care and hair trimming.
Yeah.
Right. So it's like getting comfortable around standing still and being able to trim feet or, things that I don't experience with my short-haired dogs. But yeah, those things I think about too, or prepping them for other things that you may do, wearing clothing, right? So if they have to have like a thunder jacket or a thunder shirt or to cover a suture, right? If you're not a person who dresses your dog up, and also like changing bandages, flushing wounds, those types of things, right? So getting dogs used to those things, the sight, smells, experiences of those things too.
Yeah. Cool. All right. So let's talk about restraint, right?
Yeah, it's a big one.
Yeah, especially Heather, you just brought up, and I never honestly, I hate telling people about it. But like that whole taking your dog to a different location, the groomer, the vet, the professional, taking your dog to a different location so that you don't see the level of restraint that might be needed, right? The first time I took my Chihuahua to a groomer to get her nails trimmed, it was so nice. I didn't have to deal with it. I gave her to them.
Yeah.
They went back. They came back 5 minutes later. Her nails were short. It was magic, right? I took her back a second time. This time it took longer. We needed an extra person. Okay, that's information, but we got it done, right? I don't have to worry about it for another 2 weeks. This is great, right? Took her back a third time. She's 7 pounds. They needed a third person. It took 10 minutes and they only got 2 done, right? And I'm like, oh, this is information now, right? Like, not only am I sensitizing my dog to this process that was so easy like 2 months ago, right? But it's a separate area so that I don't have to see that.
Yeah.
Right. I like,
Yeah.
I want the information. I'm glad they told me about it. And also like that definitely made me go into like danger zone in my brain of like how like this isn't like ineptitude of not knowing how to restrain a dog. This is the fact that like my 7-pound chihuahua is a squirrely little monkey, right? And she can get out
Right.
of anything.
Yeah.
But she hated it that much, right?
Mhm.
And so I think it is important that we I think that it's walking the line of like, I think people should be able to set their limit of how much they can participate, right? But also knowing that it is the responsibility of a pet owner, right, to at least help prepare our dogs for these situations,
Mhm.
right? If not participate in them,
Yeah.
so that we're learning from them. But I think that restraint.
Yeah, totally.
Yeah.
And I think that this is the number one, as I've had students come through our classes and we've talked about this, I can, when I know I have a professional who's in the pet industry, so a groomer, a vet, or a tech in my class, I always ask them, what else should we be covering during this chapter, of our class? And the number one thing that they bring up is restraint. Right?
Yeah.
Because I don't think that we as dog owners, pet parents, think about the fact that we need to prepare for this, right? Or understand why, right? Or how to even start, I guess is what I mean. It's like, and so if we think about like, so a lot of times, and for me, I'm spending time being aware of how my vet tech restrains my dog, or how they need to hold my dog in order to get a jugular blood draw, right? Which is something that a lot of us as, everyday people don't ever think about, right? It's just not in our brain about how they do it.
Yeah.
Right?
Yeah. And I don't think that like we're not veterinary professionals, right?
Right.
I don't think that the expectation is that owners will suddenly know where a jugular vein is, right?
Right.
But if we can start thinking about the mechanics of it, right? The mechanics over it, for a lot of dogs, even having a stranger reach over a dog, right? That is enough restraint that they are done,
Yeah.
right? And so like just talking about foundations, right? Of like, can you sit between a stranger's legs? Can we touch your neck, right? Can we touch your arms? Can we squeeze your arms? Can we squeeze your paws? Can we hold your tail, right?
Can we hold you at an angle that might be uncomfortable for a minute, right?
Yeah.
Yeah.
And the more that we work on these things, the more that we have the skills and the words to communicate with our vet, right? Of like, we've worked on a blood draw in this situation, right? Can we do that? Is there a better one, right? You can do a blood draw from many different locations. And so also like when you know that your dog has to go in to something, asking if whoever you're talking to, right? If they know what that situation, what that exam will look like.
Yeah.
Right. There's definitely a lot of times because vets, especially because they're overloaded right now, right?
Yeah.
Working on that in and out. Right. And so if I can be all
huge
like,
help in advance.
yeah, right. To work on that, right? Huge help to them. And then also being able to take a second and be all like, this vaccine will go so much faster if we do it this way. Right. And it does. It does every time.
Right. And it's like I love your point here about like, even though we may hug our dogs or, they might curl up with us, it's really different than having them stand on the ground or on an elevated table, right?
Yeah.
And then hold them still, right?
Yes.
And that's like completely different. So to help get them used to, an arm going over their back and holding them, right? Holding their necks still and their chests, right?
Yeah.
And so thinking about ways to kind of just work that into our training to help prep, having two people hold your dog,
Yeah,
right?
absolutely.
A second person come to the front, hold head, right?
Yeah.
And that's even all, that's stuff we can do at home just as you were saying, in addition to, like, possibly adding your friends to the situation, helping your dog get used to a stranger doing it. It just helps support them and our professionals who are helping us in the long run. Yeah.
And one of the things that I teach it in my puppy classes, but also like that's really helped me with like adding restraint, is that like make it fun, right? So the goal doesn't have to be restraint. The goal can be people do weird things, right? And so I'll throw these into playing with my dogs, right? If we're playing tug and I trust my dogs, right? So we're playing tug, as they hand me the toy, maybe I'll touch their gums with my finger, right? Maybe before I throw the ball, I'm going to go in for a pet. Maybe I'm going to bring the ball into me, so they have to come across my body, right? Hold and throw. Maybe I'll just add in some pauses, right? Some pauses and reaching over before I throw. These are definitely all based off of trust and communication. I know that if I were to have a ball in my hand and reach over my terrier, he would jump at me, right? But if I do that with my collie, he won't, right? So with my terrier, it's a lot of, I'm going to throw the ball between my legs. I'm going to drop it by my feet and just have you come into me, right? So we don't have to, like, I don't want people to feel overwhelmed of like, great, I have to work on nail trims and now I also have to do this thing. You can add a lot of these things into really organic situations you already do with your dog, right? If they're cuddling with you, add a second of pressure and then release it, right? They can either move away and be like, that was a lot, human, right? Or they'll just stay there and be like, oh, that was fine. That wasn't too bad.
Right. Yeah. Love that.
Yep.
Yep.
All right. Onward. Okay. This is the big one, especially as we get into, we're going to get into training. I love it. I do it like, I do it too, right? But we have to like talk about the like, are we coercing our dogs to stay in this situation that is uncomfortable, right? Especially for our dogs that are foodies. I think that I've been in some really nice situations where the moment a dog got stressed, they left and they couldn't eat anymore. Right.
It's really obvious when that happens.
Yeah. Right.
And super handy.
Yeah.
Yeah.
And so I think what we're talking about when it comes to like distraction or training, right? So there's a lot of conversations that like, is using food in general coercive, right? But I think I love that.
I know we're all
I'm like, oh, I have so much to say about that.
I know, but like in the context of this, if like you're setting up a licky mat or if you're setting up a peanut butter wall, which I advocate for, right? I do this for my dogs. It's part of my routine. The moment that they stop eating, right, that is the sign that we're going to start slowing stuff down or we need a higher value thing. All right, but tell me about your feelings about.
It's shocking. I have a lot of feelings about it. It's shocking. I don't. Well, I'm often talking to clients about, for dogs, when we use food, we want to be sure that we're not making our dog make the choice between safety and food.
Yeah.
Right? Because a lot of times they'll choose food because they're toddlers, right? Or I mean, not really, but they'll choose food because it's a primary reinforcer, right? And that doesn't mean they're safe. So, or that they feel safe, I should say. So we can get a really inauthentic read on how they're feeling if we just base it on whether or not they'll eat, right? And so, but it's also like, I can be a little bit of an idealist, right? So it's like, I'd prefer that we fed the dog after they tolerated the thing or whatever, not during, because then, for, lots of reasons, but that's not always ideal or practical or, that's not going to make the thing happen or possible, so it's like, it's a fine line, I think, between, I don't know, it's complicated, right? But that safety versus food thing, right? And not making it the two mutually exclusive.
Absolutely.
Yeah, and I think that, the biggest thing for us, it's sort of this idea of the training concept of luring, right? So
Mhm.
you get food on nose, dogs moving to a place or being held or kept in a place like with a lick mat or with my bowl of peanut butter or whatever, it's like are they and what are they thinking about, while that's happening? They're probably, at least initially, thinking about the food and then thinking about, like, why are they messing with me while the food's happening? Right. And then, okay, I guess I'll stay here with the food. I mean, I can only imagine what they're, like food, it's that thing of like, you know, most of our dogs are like, all right, I guess food's okay in this situation, but they may not feel comfortable. And so I think it's really, um, more often than not, I think when we do all of this stuff, just to take it a kind of a step backwards, we're trying to distract our dogs during through this stuff, right? And training is something that takes real real intention to include these things in what we do to train our dogs. And I think we don't consider, even as dog professionals, I want to be better in this, realm with for my own personal dogs and for my clients' dogs. But I think, most people in general are like, yeah, my dogs get a lick mat. But it's probably likely that we're providing them with a distraction just to get through the process.
Yeah, and that's a good point too. Just that makes me think about, using food as a distraction, like you said, to get through it versus using it as an aid to desensitize, right? Because if our dogs continue to eat and we use that as the reason to keep pushing them, right?
Yeah.
Then that's not good, right? But if we are using all their body language and all the information and delivering food in a way that they can go, okay, yeah, I'm done still, right? Or, it's not so intensive, or we're going, oh, you're eating and you've got whale eyes, and you just stood up when I tried to do that, and every time I touch your back leg, you like flinch, right?
Yeah.
It's like, okay, well,
Yeah.
so it's information, right? It's just one piece of
And like I think like another point too is that like some dogs need things to do, right? Like we can't expect that a puppy is going to stand still, right, throughout a grooming. And so I don't want people to come out of this and be all like, licky mats are bad now, right?
No.
I think they're great as long as we're being thoughtful about how we're using them, right? So
Mhm.
like some dogs need that distraction. They need something else to do, right? We know that licking is a soothing behavior for dogs,
Mhm.
right? And so as something stressful is happening, I'm gonna do this other thing too, right? Adding in some bonus treats, right? So even though your dog is eating, can you still periodically give them a piece of chicken for, right? Like something high value, right?
Mhm.
For going through that. Lick your mat, and also every time I touch your paw, you're gonna get something extra.
Yes, please.
Right.
I think that's a really great way to like utilize that too, right? And also understanding that we're not talking about dogs with resource guarding tendencies. I think it's really important to clarify that, right? If you have a dog with resource guarding tendencies, talk to us, right? First,
Right.
talk to us. And then also that would not necessarily be a dog that I would throw food and stressful handling in the same scenario, right? And that could be like, that could be specific things too. And so I also, right, like I think that one thing that also tells me that having a licky mat available might not be working is if my dog is being sensitized to the type of food. So if we always do licky mats with peanut butter, right? And then I brought out the peanut butter one day and my terrier booked it, gone, out of there. And I was like, you love peanut butter, buddy. What's going on? Right. So then we had to do cat food, right? But that tells me that it's staying stressful in his body. So even though he's eating, and he will eat the licky mat itself, he will eat all of the peanut butter, right? he's not coming out of that and de-escalating,
Yeah.
right?
Mhm.
And so I think that instead of, right, it's this gray area, right? There are many pieces that tell us whether it's actually being useful in our training situation
Mhm.
or if it's not. And then moving forward from there.
Mhm.
Yep.
Okay, friends.
Fun.
Yeah, so now let's talk about the training part of it, right? There's gonna be more, right? Human talking, but the training part of it is like, great. We're giving you all this information. That's so cool. What do you
Right.
even do with that, right? Like,
Yeah.
where do you start besides just Googling stuff? And so here for me, these are foundation tricks that I had a really fun time introducing to my dogs. Okay, honestly, I taught them a bunch of tricks. I was like, this is great. Do we forget them now? Like, what do we do? And so the moment that I saw them in cooperative care context, it made me feel so much better.
Mhm. Yeah, they're useful, right? It's
Yeah,
not just parlor tricks. Yeah.
Yeah. I think they're super useful. And I think a lot of it is like um adding duration. If your dog already has a lot of these tricks, right? Adding extra time before
Mhm.
releasing them. So the general scale is teaching a hand target, right? What I like about a hand target is that it gives my dog more context of what to do with their nose. So I can use that. We talked about licking, right? Or muzzle punching or nipping, right? Your hand or
Mhm.
the tool. And so having a dog that knows a hand target, I know that a hand target to the tool means that we're done. Um,
Mhm.
I also think that it's a fun giving the dogs other context with the tools. So I'll actually put a Dremel up, right? And I'll just let my dogs knock it down, right?
Mhm.
Like target the Dremel, knock it down. Great. This is a fun trick. We're changing context. So other things are a chin rest. And so here I just do an open palm. My dog brings their muzzle onto my palm, and then we're adding in reaching over so I can lift up his jowls and look at his teeth. Um, I also add that into our middle. So I teach my dogs to sit between my legs. It's really fun and rewarding. Dax loves the crap out of it because it means attention. It's the only thing it means
Mhm.
is attention, and it's great for him. But we use this. I added the chin rest, so he can actually move his muzzle out of my hand. But I added the chin rest. This is how we did eye drops when he was having some
Mm.
allergies. We did eye drops this way. This is him sitting between my legs. We could also build it up to a blood draw. That's why I'm poking his neck. I don't know where the jugular vein is.
It's right under his collar, so that's
Yeah.
good. It's perfect for that. Yeah.
So just adding some poking,
Yep.
and then a rollover onto your side. And he doesn't actually know this, but I got him to do it once, and that was great. But
Mhm. I love
um,
that.
dogs don't like being in prone positions, right? This is
Mhm.
also one reason that like the trick rollover can be particularly hard for some of your dogs.
Mhm.
And so teaching them to lay on their side on cue, right?
Right.
Can be really helpful for accessing their belly, also for nail trims. And through all of this, he has ways that he can opt out of it, right? For the hand target, he'd just up and leave, right? For the chin rest, he removes his muzzle from my hand. Same thing with the middle, right? If we have a chin rest, he'll remove his muzzle from my hand, or he'll stand up because he's sitting right now. So I know that he's getting done when he stands up, and then we let go.
Mhm.
And for the rollover, for being on your side, it's just that head lift, right? Normally that head lift is also like treat now, but I know that when he's requesting a treat, he is getting over threshold, right? Like that
Mhm.
was a lot human treat now, right? Yes, absolutely. And also we're gonna call it.
And I also would add to this, like, it's the hand target, you build up duration too, so we talk a lot about in our classes about touch, like dog touches your hand once, right? And then but if we can get a hand target with some sustained
Yes.
pushing, right? Or some pushing and then get timing.
Yes.
So that's that idea of building to it, and building that duration. And then, it's been useful for me to get to know my own personal dogs, to know that you know, 2 of the 3 of them would probably be fine with that rollover or lay on side trick. 1 would not,
Yeah.
right? And it's not something he naturally offers ever, right? And so I'm going to look for another option for him if my dog, you know, I'm going to be thoughtful about, well, does my dog ever get into this position even comfortably, right? When
Yeah.
they are fully comfortable, asleep, whatever. And it is very rare that, you know, one of my dogs does that. So I would probably do something different, right? So it's more of like, maybe I do the middle and then I have him be comfortable putting his feet up in my
Yeah.
hands so that I can get away for, you know, his underbelly to be looked at or access to that side as opposed to the flop, you know.
Yes. Yeah, that's great. Yeah.
Mhm.
Emma, do you have any?
No, I do
That
not.
looks awesome.
Yeah, it looks great.
Yeah, and I just love the point of like, if your dog, because like my terrier won't do the rollover on us, right? There's some reason that Dax is in all of these, right?
Right.
And so, right, like making it fun and enriching and unique for your dog's own personal interests,
Mhm.
right? How much effort would you have to put into teaching a rollover versus just teaching your dog to put their feet on your hands or on a step stool or
Mhm.
something, right?
Yeah, right.
I bet
On
that
the
would be a
stool,
lot
good one.
easier. So like, you know, you can also gauge how much work is this step going to be, and can we have something that's going to be more likely to happen and just build off of
Right.
that.
Yep, totally.
Cool.
Cool. All right. So breaking down a training session, should we do, Heather made a video of Wyatt nails. Can we do that first?
Yeah, let's do it.
Let's look at that first, and then we'll kind of break down what you might need in a session.
Do you want me to talk about what I did, or do you want me to just listen to you guys looking at it? Because I want to hear that.
We should all chat. Yeah, we should all
Okay.
chat about it. And I'll pause if there's like a really good point. There's a really good part right here that I'll probably pause and be like, "This is amazing."
Let's talk about it.
Yeah.
Okay.
Y'all can still see.
I didn't realize Newton was in the bottom.
Oh, oh Newton.
That's hilarious.
He's great.
So my nail trimming routine is to give my dogs peanut butter, and they get up in this chair, and then I reach for their paw.
And what I like, I'm going to be honest, when you have multiple dogs, I do not mind, as long as it's not traumatizing the dogs, if they choose to sit there and participate and watch. I also feed my dogs for sitting there and participating and watching.
Right.
That's how I've gotten a little bit more. Oh, I missed something. Hold on, fast. So this right here.
There's a lot of gold in the beginning of this one.
No, this is okay. But this is a pet peeve of mine, right? So that's a wonderful face.
Yeah, I know.
So you go to try this paw again, and you can tell she stops licking, she gets up, she moves away, you get some whale eye. Instead of continuing to try that paw, you're like, what about the next one?
Yep.
Mhm.
Right? I don't feel like, as humans, we also have to be really flexible in this, right? Just because your dog isn't digging one paw doesn't mean they aren't digging all of it. A lot of dogs have a preference, right? They're more comfortable definitely with you touching their front than their back. I've never seen a dog but maybe they're not, right? But they always have a front versus back, and then dogs normally also have a left versus right, right? And so what I love is you're like, can I? And she's like, no. And you're like, how about the other one? Right? And that was great because she's like, all yes, right?
Right. Yeah, totally. And so that allows me, and because she's still eating, she's not bringing her head up, you know, she's not, I mean, she is sort of the slip away of the container isn't ideal, you know?
Yeah.
And then I go back to this first paw, and then she's like, oh, okay. A little better.
Exactly, right? We feel better because we did an easier paw. Now we're going to go back to the hard one, and you're good. Some things that I do, I use binder clips a lot to hold things to tables and chairs and other equipment, right? Like the office supply binder clips.
Mm-hmm.
That right there. So thinking about how you're moving your dog's foot, especially to access their hind legs if they're standing. I have Jordy prefers to stand with nail trims, and I think it's ridiculous. But he prefers to stand.
Right.
And so lifting the knee up and towards their front, very uncomfortable. Right. It throws them off balance, very uncomfortable. So what you did is she was like, this isn't working. And then you went back. So a lot of people don't know this, right? But lifting their paw back so you can still see their nails, right? Is a lot more comfortable position on that knee. It leaves a lot of hip stress, right? She's able to, at the back of the chair, she's able to lean against that, which is awesome, right? So we're not throwing her off balance. I think that was a great.
Yeah, and I also make sure that her knee is bent, so her leg is not fully extended back.
Yeah.
However, her tail is tucked, right? This is not something that she's 100% comfortable with.
It's true. Yes.
Right.
But
yeah.
She has an escape route, right? And
exactly.
we know
she can totally leave.
we know from the first 30 seconds that we know what her stress signs look like now.
Right.
Yeah. And one thing that I know it's on mute right now, but one thing that I'm curious about is the noise of the clippers. I noticed that she kind of flinches whenever. And that also is just an example of, one small component that isn't causing her to like flip out and quit, right?
Yeah, absolutely. Yeah.
I pushed it at the end there just now. It was I had one last nail to get done, and I definitely felt myself being like, well, I just want to finish up, right? And she stopped eating, pulled up, like it's interesting.
Yeah, and there's something else there, right? So yeah, I think the sound of the clippers, sometimes if I get to the just one more zone for me, right, I won't touch the nail, but I'll still do the clippy, right? Are you still learning? Are you still in the learning zone? I like that you let her finish. A lot of times I will give my dogs a jackpot in that area, right? So still good vibes in this location.
Yeah.
And also
and this was a dog, like I said earlier when we were just talking one-on-one, that's only the second time ever that she sat through all of her nails being done. So usually she jumps down and takes a break, and this time she didn't.
Yeah, I think that
says you're going in the right direction.
Yeah, that tells you you're going in the right direction.
Yeah.
I don't, and it depends on your dog, but because you were finishing up and you said just one more, right? Thinking of that as like a keep going cue, right? An almost done cue, if you're prone to saying that, right?
I probably did actually.
I think that can be useful information for your dog, right? And how you would do that is just adding that before you plan on ending, right? And so what I do, like if my goal is like 2 nails, right, then I'll do the first one and I'll give some treats, right, and I'll do the second one and I'll be like just a little more, right? Like we can keep going. And that can just be anytime that we can give our dog extra information in the situation can be really helpful.
Yeah, totally.
All right, so let's break down starting or planning a training session. So we'll just use Heather's example, right? So you picked your environment, right? Thinking about what environment you want to start at, whether that's location that your dog's gonna be most comfortable, whether that is an accessible elevated surface your dog is comfortable at. I don't like to start in rooms that are already scary, right? If my dog is questionable about the bathtub, I'm not going to start grooming in the bathroom. Desensitizing to the bathroom is going to be a separate game all around, right? So I like to start where they're already kind of cozy and comfortable. That tends to be the kitchen a lot for my dogs, since also where bonus food happens.
All right.
And so thinking about what location your dog can work versus what your goals are. If your goal is a grooming table, right, your dog might not be ready to just jump onto a grooming table. And so maybe using a chair like Heather did to approximate that, right? Maybe putting the grooming table in a room they're more comfortable in, right? Even if your goal is to move it eventually, right? So thinking kind of about the environment you can start in to do some of this versus where you want to move to. And maybe I don't care where I groom my dogs, right? And so I kind of just do it around the house wherever they're most comfortable, and we're gonna end up working for them.
Yeah.
Yeah. And then thinking about like tools and props, and we talked a little bit about earlier about like props that you might need to approximate something, right? We're not everybody has a
Right.
muzzle on hand. Not everybody
Yeah, or
has a stethoscope. Yeah.
Yeah, I can't say that word. Yes.
Yeah. I mean, even
Exactly.
like a cone, right? I actually don't own a cone right now.
Right.
And so, you know, what we use to approximate that, cardboard boxes, towels, right? Things that my dog has to shove their head in and out.
Right.
Even
Yeah,
just,
for muzzles, I like to cut the bottom out of a cup,
yep.
you know, so you can have access to the bottoms cut out of like even just a red Solo cup so they can stick their nose in, get fed into it.
Yeah, absolutely. Even like, so if you plan or you want to use a Dremel, but you haven't ordered one yet, right? Electric toothbrushes get a very
Right.
similar effect
Yep.
as a Dremel, right? Even the clipping sound on like human nail clippers, right, can be at least similar enough, right?
Yeah.
Before you actually have like, I know puppies grow a lot, and so you might have puppy clippers, and then suddenly your dog has adult nails, and you're like, these are not doing the job.
Right.
And so just kind of, you can get, and for like a stethoscope, honestly, like using an ice cube, right? Using something that has like similar vibes, texture, that type of thing.
That's awesome. Good
Um,
idea.
yeah, just to approximate that type of discomfort. So you don't have to have the tools on hand, just get creative. And then we talked about it a lot, and I think it's really important to plan breaks, right? So if your dog opts out, letting them opt out, reinforcing them to opt out, right? With Wyatt, when she showed the stress signs, you weren't like, well, you can't have this now.
Right.
Right? You were like, I think you moved it, right? Because part of the stress was that it was sinking.
Yeah.
But the whole time you were like, just like the peanut butter, friend, right? I'm gonna remove myself. Is that enough for you? And that was.
Yeah.
But planning in, if you know that your dog has a hard time staying still, or if there's a lot of pressure for your dog, or your dog has none of these things, right? But what I like to do is like, every time we do something scary, right? That might be the first nail, right? That might be the Dremel making contact with your paw, right? I'm going to treat there, and then I'm going to toss it away, right? Move your body, come back into the position,
Right.
right? Because I want them to rehearse that. And if my request is to come back and they don't come back, then we're not pushing that, right?
Yeah, and that's that piece that takes us back to the idea of the dog doesn't already have kind of a flight cue or a leave, take a break cue already built into who they are, right? They're not a dog who feels like they can do that. That helps support training that skill too, so that we can then, so giving them that planned break with a toss of treat behind, finding, asking, if you will, if they want to come back. It's not just gauging, are you ready? We've set the scenario, what's available to you for high value reinforcement. Are you going to choose to come back into that situation? If so, great, we keep going, right? And we use our keep going signals. We do one more for the dog, give them a break, and that helps us kind of frame the whole training session for them with a dog that may not naturally take a break.
Absolutely. Yeah. And right, like, don't always trust your dog. I'm gonna be honest, I don't trust my terrier will stay there as long as humanly possible, right? He should not be staying there, right? He will tolerate more than he can handle. And I know that because
yeah.
I've listened to
point.
him, and then he's been afraid to come back a week later to the same situation, right? So I know I cannot trust him. If he's like, no, I'm good, I know that means you're not, and you need to
Right.
leave, right?
Yeah.
And so honestly, when it comes to nail trims or like being okay with the smallest approximation, right? I'm just
Mhm.
going to touch your nail. I'm going to do one nail every other day, right? That type of thing.
Mhm.
When we set the bar low, our dog can exceed our expectations, right?
Yeah.
When we set the bar high, we're setting everybody to fail, that type of thing.
Yeah.
Yep.
Yep.
Good point.
Yeah.
Good.
Yep.
Awesome. And I think a lot of that ties into like how we can assess that we're making progress, but also how we want to progress too,
Mhm.
right? And so,
Yeah,
you
just
know,
and the biggest piece of this, in my opinion, is give yourself time. Don't bump up against a timeline, right? This is just
yeah,
about, giving yourself and the dog the time to progress. If it
yes.
needs to take a week and needs to take a month, like it does.
hmm
Yeah.
Absolutely. I mean, and that's, the benefit of like planning ahead, right? There are a lot of things we can
Right.
do to just kind of get through, right?
Yeah.
Like your dog needs medications now, but we haven't
Right.
worked on, a lot. I feel like it's always better to plan ahead, but a lot of us are here, right?
Right.
Because we didn't plan ahead.
Yeah.
Um, and so, taking this information into account as we're trying to just get through whatever the most immediate thing is right now,
Mhm.
right?
Mhm.
And so, whatever situation that might be in, just kind of weighing.
Yeah.
Cool. All right. Any final thoughts? I think we actually covered a lot of my like,
Yeah.
but what if we
We
don't get here questions?
Right. No, I think this is good. I mean, I think for me, the things that I'm most aware of and want to make sure that our clients are aware of and our friends are aware of is that, to be that advocate for your dog, to take your time, right? And this is sort of a growing and more relevant than ever kind of thing that we can do with our dogs. And I think it's something that we should normalize into our everyday training.
Yeah, absolutely.
Yep. Sure.
Perfect. Cool. All right. So the big thing is we've got workshops coming. We've got webinars coming covering these issues, breaking them down. This is a lot, right? And
Yeah.
so
Right.
breaking these into smaller increments, right? Just like we do in training.
Mm-hmm.
So you can always reach out to us or take a look at our website for our class coming up. I think all of our classes, maybe minus agility, like even agility is applicable, right?
Yeah.
Body movement, teamwork, understanding your dog,
Yeah. Getting
all of
on things.
getting
Yeah.
on things on
Yeah.
cue, right?
Going.
Building that
Yep.
confidence around
Yep.
strangers.
Yep.
But all of our classes touch upon an area of cooperative care, right?
That's really true. Yeah.
And cooperative care that's age appropriate, right?
Mm-hmm.
Puppy class, we do puppy stuff, right?
Yeah.
But that can also be different. So
Yeah.
even if you're all like, great, let's get started, right? Today we cover all of this stuff in our
Yeah.
classes because it's that important.
Totally. Yeah. It's great.
Yeah. Cool. All right.
Well, thank
Thanks
you
for
all.
Thank
listening.
you. Yeah.